Hi, I'm Caroline Newsome. I'm an attorney at Newsome Law. In this video, I will be discussing bladder and bowel control for people living with locked-in syndrome. Locked-in syndrome is a rare neurological condition caused by damage to the brainstem, usually the pons. People with locked-in syndrome are fully conscious, but almost completely paralyzed, often able to communicate with only their eyes. Unlike a spinal cord injury where the bladder and bowel nerves are directly damaged, locked-in syndrome usually leaves those circuits intact. However, because voluntary motor control is lost, the individual cannot reliably manage their bladder or their bowel function on their own. This can lead to problems such as urinary retention, incontinence, urinary tract infections, constipation, or fecal impaction. Most people with locked-in syndrome cannot feel when their bladder is full or signal when they need to void. The bladder may overfill or empty at unpredictable times, which can cause discomfort, infection, or kidney complications. To keep the bladder healthy and reduce complications, a care program usually includes scheduling emptying of the bladder, often every 4 to 6 hours, getting adequate fluids by mouth or feeding tube, and monitoring for infections like fever, cloudy urine, or strong odor. Several bladder emptying methods are used in locked-in syndrome. One method is called intermittent catheterization, where a thin tube is inserted at set times to drain the bladder. This is a preferred long-term method because it lowers the risk of infection. Another method involves the use of indwelling catheter, which stays in place with a small balloon inside the bladder. This provides continuous drainage, but has a higher risk of infection. An external condom catheter is another option for male patients only. A special condom device drains urine into a bag. This can be useful in some cases, though not always practical. Bladder training and medications are also options. In some cases, bladder reflexes can be triggered on a schedule, and medications may be prescribed to relax the bladder or control spasms. Due to immobility and lack of voluntary control, bowels often become sluggish. This leads to constipation, incontinence, and risk of impaction if not managed properly. A bowel program can help establish a predictable schedule. It often includes scheduling toileting at the same time, often after meals, using softeners or mild laxatives to prevent constipation, using suppositories or small enemas when needed, and consuming plenty of fluids and fiber, if swallowing is safe or provided by feeding tube. For caregivers, monitoring is essential. Since patients may not be able to communicate their discomfort, caregivers must track urine output, bowel movements, and watch for warning signs. Additionally, it's important for caregivers to remember that preventing complications such as UTIs, kidney problems, fecal impaction, and skin breakdown can often be avoided with proactive care. Interdisciplinary teamwork between urologists, gastroenterologists, rehabilitation medicine, and nursing staff can be a huge help for caregivers when creating individualized care plans for their loved ones. Bladder and bowel control are major challenges for people with locked-in syndrome. Although the underlying nerves may still function, the loss of voluntary control and immobility mean that careful management is essential. With the right programs, including scheduled catheterization, bowel routines, and vigilant monitoring, these issues can be managed efficiently, allowing patients to live more comfortably and with dignity. This concludes our segment on bladder and bowel control for locked-in syndrome. If you or someone you know has been diagnosed with locked-in syndrome and have questions about medical care or legal rights, visit us at Newsome Law. We're here to help.